Yeah, so good morning, good afternoon, everyone. My name is Matthias Müllenbeck. I'm heading Global Business Development and Alliance Management at the Healthcare Division of Merck KGaA, Darmstadt, Germany. And I'm really happy to talk with you today about our partnering approach and perspective at Merck. Just a quick overview about who are we at Merck. So Merck is the oldest pharmaceutical company in the world, founded in 1668. Today we're making roughly 20 billion in revenue, of which a substantial portion we reinvest really into R&D, 2.4 billion. And our commercial footprint is really across 66 countries with own subsidiaries. Merck, so us, we hold the name right outside the US and Canada, and within the US and Canada, we operate under EMD Serono for the healthcare division, Millipo-Sigma for our life science division, and EMD Electronics for our electronics division. As that implies already, the whole company is built up of three sectors. So we have a healthcare sector, a life science sector, and an electronics sector. In our healthcare sector, we really focus on specialty pharma markets. So these are largely prescription medicines, and our research focus here is on oncology, immunology, and immuno-oncology. And we have really, if you look over the last years, a quite successful history of portfolio managements with, for example, the divestments of our consumer health business and a lab pharma. We'll talk a little bit later on about also our in-licensing streams when it comes to M&A and licensing. Our life science division is really a leading player when it comes for biotech research and production, or literally anything that you need with regards to tools and laboratory supply. And our electronics division is a leading company in the area of high-tech solutions. So think about chemicals that you need, for example, to produce an iPhone. There's a high likelihood that these come from us. Additionally, there we have a broad portfolio really of decorators and other functional solutions. So zooming in a little bit on the healthcare business. The healthcare business contributes 36% of the group's net sales, with an R&D spend of 1.7 billion, not surprisingly the largest amongst all divisions. And that net sales share really is reflected below here at approximately 7 billion that we generate with 17,000 to 18,000 employees globally. For franchises, spans our portfolio, really one franchise in oncology and immuno-oncology, another franchise in cardiovascular metabolism and endocrinology, another franchise in neurology and immunology, and last but not least, our fertility franchise. Thinking a little bit about the pipeline, and this is a very simplified chart, I just want to quickly talk you through it. So starting from the right side, really. So we have two late-stage molecules. One is everolimus, our BTK inhibitor that we develop in RMS, and the other one is our IAP antagonist xevinapant that we developed in locally advanced head and neck, cis-eligible, cis-ineligible. If we move then a little bit more to the left of the slide here in the middle, you really see our more advanced mid-stage clinical development compounds. On the one hand, this is enpatoran, our TLR7/8 inhibitor that we develop in CLE and SLE, as well as our c-Met inhibitor, tepotinib, already an approved molecule, but we are extending the indications here with a trial in NSCLC EGFR MET-amp. If we move then to the early development and also late-stage research game, maybe starting with the early development piece, we just moved new ADCs into the clinic. One example here is M1231. ADCs is really one of the strongholds that we want to develop, and we'll come to that in a second. Another good example here is our oral DNA damage repair inhibitor portfolio. Most importantly, I think to name our ATR inhibitor that is currently in phase 1 development. Moving then a little bit more to earlier stage here, as said, ADCs is an important topic for us, so we're really building here out our not only our capabilities but also our portfolio of preclinical candidates that we want to advance into the clinic in the not too distant future. And also PROTACs is an area of investments with deals that we had also done earlier this year. for example, with Amphista and Proxygen. Now, let's zoom in and shift gears a little bit towards business development. So for us, really, in business development, proximity matters. Yeah. As you can see on the slide, really, the business development team is spread around the globe, really, from Sao Paulo, San Francisco, Boston, London, Darmstadt, Beijing, Tokyo, and Singapore, because we really believe that we want to have a very good, not only understanding of the local innovation environments, but also really have local networks to understand really what a winning deal formula looks like for you. And in deals, we're relatively active. So approximately, and this is just really a selection here of a non-exhaustive list. So approximately, we're closing about 100 transactions or more than 100 transactions per year. Don't want to go through all of them, but really maybe just to point out a few. One of the latest deals that we did was a phase 3 licensing deal with the Biopharm. So this is per se a straight licensing deal with a co-development component for the activities. We have also and had large co-development and co-commercialization partnerships. The largest ones with GSK and Pfizer, where really we built integrated metrics teams to work on a co-development, co-commercialization of, in this case, our two of our IO molecules. We talked a little earlier a little bit around platform deals. Already mentioned the deals with Amphista and Proxygen, which we just really a couple of weeks ago executed. Another good example here is the platform deal on the nuclease portfolio of Artios that we did in 2021, as well as ADC platform deals that we did in the past, for example, with Sutro and Mersana. From an M&A perspective, we also get more and more active. Again, last year, end of last year, we executed an agreement to acquire Corp Therapeutics, because this is a company with, let's say, IP and a formulation development of cladribine in the areas of MG and NMOSD. So this was really our first external or inorganic growth move in the area of neuroinflammation. And then also a couple of years ago, we acquired the DNA damage response inhibitor portfolio of Vertex. Partnering with biotech companies is great, but it's obviously not everything. So we are also very strongly engaged with the academic community because we feel this is also a great foundation to further test our ideas and generate new hypotheses that we have. We have a number of flagship academic collaborations with the Weizmann Institute, the National Cancer Institute, the MD-ACC, as well as the University of California, San Diego, plus many, many others. Don't want to go into too much detail here, but just that you know that we're really having a very robust PI network that we can leverage to advance our thinking and test our hypotheses. One thing that is maybe not obvious to everyone, but we are really one of the largest multinational companies in China as well. So we do have not only commercial capabilities with our own subsidiary on the ground, but we also do have an R&D hub as well as local manufacturing sites. And for us, this is really a very, very important market. I mean, it's the second largest healthcare market in the world for our company, and is also the #1 country when it comes to oncology and CM&E. Why I think you're not surprised to see the majority of our brands really being commercialized locally. When it comes to partnering, we are really super interested in any types of collaboration and licensing proposals for global and or local China, Asia, right? So please really put us on your radar screen, where we are super excited. We'd be super excited to have a conversation around that. Talking a little bit more about the general search scope. So as I said earlier, we have 4 franchises. So 1 cardiometabolic endocrinology franchise, 1 fertility franchise, 1 oncology immuno-oncology franchise, as well as 1 neurology immunology franchise. And I just really want to quickly talk you through about the different dimensions of what we're looking for and whatnot. Of note, the oncology, immuno-oncology, and neurology immunology franchise are fully integrated franchises, meaning that we really are interested and have in-house capabilities from very early research up to really commercial, whereas fertility and cardiometabolic and endocrinology franchises are focusing mainly on late-stage R&D as well as commercial opportunities. So in CM&E, just to quickly run you through this, in the area of metabolism, we're really looking for opportunities in the type 2 diabetes space, as well as in the genetic obesity space. In cardiovascular, we're looking in the areas of hypertension, heart failure, lipid regulation, coronary artery disease, hypertrophic cardiomyopathy. When it comes to thyroids and endocrinology, we are looking at hypo and hyperthyroidism, hypoparathyroidism, growth hormone regulation, achondroplasia, type 1 diabetes, and PCOS. Fertility, we're already world market leader, but we are really kind of driving, let's say, a very active inorganic growth strategy here as well. So when it comes to novel drug delivery technologies, we're looking at all FSHR, LHCGRs, and GnRH agonists, as well as progesterone supplementation. For our novel therapies and technologies, we're looking at oocyte quality and quantity improvement technologies. We're looking at controlled ovarian stimulation regimens. We're looking at luteal phase support approaches and at endometrial receptivity and implantation potential. For the digital health services, we're looking at emotional support programs and any kind of AI-based solutions. Moving over to oncology and immuno-oncology here, coming from an indication focus, we are really looking at GI, GU, and thoracic. And when it comes to areas of interest, it is focused on DNA damage response, oncogenic signaling, myeloid cell biology, and protein stress responses. Modalities is for us the full spectrum. That means 4 modalities: small molecules, biologics, antibody-drug conjugates, as well as targeted protein degraders. Not in scope is hemato-oncology for us. Moving over to neurology and immunology, here we are looking, when it comes to indication, really in neuroinflammatory diseases, neuromuscular diseases, peripheral autoimmune diseases. And then switching to areas of interest, we are looking at innate receptors and inflammation, antigen-specific targeting of T and B cells, tolerance induction, as well as remyelination. From a modality perspective, it is also the 4 that we engage in, meaning small molecules, biologic, ADCs, and targeted protein degraders. There was the in-licensing side. I also want to very clearly state that we are very actively looking for externalization partners for molecules that we do not proceed with. Again, there's nothing wrong with these molecules, but as I said earlier, we have a very active portfolio management philosophy, and instead of putting things that we believe in on the shelf, we really want to find partners. There's a number of opportunities out there where we either did a straight licensing to a biotech or pharma organization, or where we generated together with investors really a company around an asset. And that is, I think, really essential to understand that for us, we're very happy to structure these agreements also around equity to make the deal financials work for the investor community. So also here, please reach out to us if you're interested in certain asset categories. So what are our priorities then? To summarize, I mean, our priority 1 is clearly focused partnering, licensing, and M&A of selected opportunities, mainly to expand our late-stage pipeline and product portfolio. And by that, we really want to generate significant value for Merck through such alliances in the foreseeable future. Priority number 2 is clearly to complement our research strategy with specific technology platforms of high innovation potential, so that we can leverage by that really the pharma, biotech, and investor ecosystem appropriately. And then last but not least, we also are looking for partners to maximize our pipeline value through the strategic externalization. As I said, this is not for us just a licensing transaction. We're also very much interested into utilizing equity and building companies around these assets, because we believe in these assets and want to put them in the best hands. So we're always curious if you want to talk with us, really present your idea or get a feeling of what assets we have in the out-licensing channel. Please reach out to my team, to myself, or just have a look at our partnering webpage. QR code is here on the screen, and you also find that webpage under www.merckgroup.com. So enjoy the conference and hope to be in touch soon.